Hello, everyone. My name is Dr. Omar Awan. I'm a professor at the University of Maryland School of Medicine. I want to talk today about issues with COVID-19 that get little media attention. Nobody is talking about these issues. Now, we often talk about the vaccines, the deaths, treatment for COVID-19, but there are other equally important issues that definitely deserve attention in the media. For example, jobs. How are jobs being affected with COVID-19? Well, there's something called long COVID, right? Long COVID, as you all know, is having symptoms of COVID-19 3 months after you have been initially been infected, and those symptoms didn't exist before you had COVID-19. So things like fatigue, loss of memory, all these things, cardiac impairment, all these things are symptoms of long COVID. And long COVID can be debilitating. It's affecting people, it's affecting people's ability to return to work. And it's causing an increasing amount of people, resulting in disability. And this is resulting in 15% of unfilled jobs. There has been research that shows that disability from long COVID will account for 15% of unfilled jobs in America. Well, what does that mean? That means that 1.59 million jobs in America will go unfilled because of long COVID. This is going to have a profound impact on people. Inflation is at an all-time high in America. Families are struggling to put food on the table, get groceries. Many Americans, because of COVID, will suffer because of these unfilled jobs. And then if you took a look at, medical health professions, the finance sector, retail, whatever it is, there will be less people filling those jobs, resulting in less manpower, making it frustrating for people who come to get certain services, and people will have to work longer hours to fill some of these jobs. It will have a major impact on the American people and the American economy. Infertility is another issue that doesn't get enough press in the media. So COVID actually affects the reproductive system, as it affects many different parts of the body. So COVID is known to decrease ovarian reserve in females, and also sperm count, motility, and even sperm morphology in males. But what does that mean? That means that there's increased infertility in the population. Fertility rates have steadily been declining since the 1990s, and currently there's about 1.7 births per female in the United States. This is down from 2.1. And 2.1 is what's required to have a steady population without the need for immigration from outside in the United States, for the United States to have a steady population throughout. But 1.7, as you can see, is less than 2.1. Well, this is going to have major implications for family planning, and a lot of couples will have anxiety, maybe even suffer depression because they're not able to conceive. The media must make the public aware that this is going to be a problem, to decrease anxiety, to decrease the frustration that many couples will experience because of increasing infertility rates. And finally, testing. Testing is a major issue in COVID-19. There are multiple ways that you can get tests. The most common tests are nucleic acid amplification tests, as well as antigen tests. The rapid tests that we all know that take 15 to 30 minutes is the rapid antigen test. But the more reliable test, PCR, which is a type of nucleic acid amplification test that uses genetic material to confirm the presence or absence of COVID. And that's more reliable, right? But PCR has a high false negative rate, especially in children, because they have decreased viral load. So there's a high false negative rate in children. What does that mean? Well, that means that certain children that are getting tested, it may be negative, but they really actually, in fact, do have COVID. So we're underestimating childhood infection rates for COVID. Based on CDC data, people that are between the ages of 0 and 18 years have about a 70% incidence of COVID in the United States. They account for 17% of COVID infections in America. Well, a lot of proponents to vaccines, a lot of skeptics cite this. They cite the fact that, well, we shouldn't vaccinate children because they have such a low COVID infection rate. Well, that data may be skewed, right? Because PCR is not catching all of the positive rates for infection in children. And certainly that should not be used as evidence against vaccinating children, right? Because it's likely much higher than that. So evidence should be used in the appropriate context when informing public health decisions, right? So all of these are very important opportunities and very important issues that we should all address when assessing COVID-19. Thank you so much for your attention. For more information, please click on the link below and look at my Forbes article where I discuss all of these important public health issues. Thank you so much for your attention.